Hello, welcome to Testing with MicrobeLink Dx. You have received your 11 microbes test. So now you want to know who to test. Who could I use the 11 microbes test on? So I'm just going to give you a few ideas. Number one, anybody with bleeding gum tissues could use a bacterial test. Those are the patients, the first sign of an infection is bleeding gum tissues. So anytime you have bleeding, you could do a bacterial culture on them to really find out how bad is this infection. Number two is anybody with 5 millimeters plus, because we know that these pathogens, these 11 pathogens out of the 5 to 700 particularly, love to hide down in the deepest pockets. So that's where we harbor a lot of those anaerobic pathogens. And so those are great areas to sample. So those patients with bleeding gums, pocketing 5 millimeters plus, and then also patients who are systemically high risk. You know, we know there's about 56 diseases linked to periodontal infections. So if you have a patient that has heart disease, diabetes, maybe going in for chemo treatment, anyone that's marked something on their medical history, that would be a high risk patient. So those patients, you definitely do not want an infection running around in their mouth. Because we have to remember the amount of gum tissue in your mouth is what is on your forearm. So if that is infected, what is that is doing to the rest of the body? And then patients who are resistant to therapy. So maybe patients you've already taken through scaling and root planing. So let's say you have a patient, you took them through scaling and root planing, you had them come back in for their follow-up, and looks a little better, but just still it's not there. They're not healthy gum tissues. We want nice pink healthy gum tissues. So if they're just not there, it'd be a good time to do a bacterial culture. Hey, everything looks a little bit better, but we're just still not where we need to be. Let's grab a quick culture on you. You may have an infection. We may need to do additional treatment. So those patients resistant to therapy, even those patients who you maybe be in your 6-month recall care that are not prophies, there's bleeding gums, that's not a prophy patient. So those are the patients that you could say, let's grab a quick culture on. Patients who are treatment planned for implants or who have implant failure. We know the same reason implants fail is the same reason natural teeth fail. So if you have a patient that you're going to be treatment planned for implants, it'd be a great idea to do a bacterial culture prior to implant placement. So if that's a new patient coming in, grab a culture, because that patient may need to be ran through your perio program prior to implant placement. And then if you do have patients that you've placed implants or come into your office that already have had implants placed and they're on the fence, they're just not looking like they should look, then you could do a culture because you definitely want to catch it early. And then patients who need medical clearance for surgery. So for example, those patients that the orthopedic surgeon sends in hey, this patient clean bill of health, those are patients that they're really looking for infection, especially those pre-med cases. Or if a patient's going to be going in for a major surgery and intubated for several hours, you definitely don't want the bacteria in the mouth to make their way to the ventilator tube. So those patients going in for medical surgery or that who need medical clearance, those patients you want to do a culture on just to eliminate any extra infection. So patients with bleeding gums, patients with pockets, patients who are systemically high risk, patients that need clearance for gum or for surgery, patients who are resistant, and implant patients. So that's a lot of patients. So good luck testing, and let me know if you have any questions. Bye, y'all.